We've all had headaches from time to time. Most of the time we can take 2 Panadols and that's the end of it. But there are those occasions when sometimes we stop and wonder, is this headache more serious? Good morning, Barbados. Good morning, Veoma. This is Dr. Bandele Majax from Urgent Care Mobile, and today we're talking about when to worry about headache. What are the serious symptoms and signs that manifest when we have a more sinister cause of headache? When we talk about sinister headaches, we're referring primarily to causes such as brain tumors, aneurysms or bleeding in the brain, and serious infections. The symptoms that may present with these kind of diagnoses include a very sudden onset of headache, which might wake you from your sleep, a very severe headache, often described as the worst headache that you've ever had, a headache which is different from your usual headache or your usual migraine. So typically with a migraine, you get a pain which is localized to one side, and you can often predict when the migraine is coming. When all of a sudden you notice this headache is occurring on a different side, it's coming without warning, that is a serious cause for concern. Headaches which are associated with confusion, so you yourself may not notice this particular symptom or sign, but your relative may notice that you're complaining of a headache and they find that you're getting confused. Headache associated with very red eyes is also one of those symptoms that we should be concerned about. But one thing I need to speak about in particular is a symptom or it's something that we've noticed presenting in the emergency department a few times recently. And this is the phenomenon of postcoital headache. This is one of the hallmark features of bleeding in the brain, and anyone having this type of symptom should try to seek medical attention in some form immediately. Last but not least is headache following any trauma to the head. So if you've had a head injury, and regardless of how significant you may think that head injury is, if you're having a headache, you've taken some Panadol and it's not going away, this is a serious cause for concern. Seek medical attention right away. Once again, folks, I'd like to remind you that not everything in medicine is clear-cut. These are only some mild suggestions that you may look out for some of the causes of serious headache. But remember, whenever in doubt, seek medical attention right away. This is Dr. Bandele Majax from Urgent Care Mobile. Have a wonderful day.